Sound check 1 2 3. Sound check 1 2 3.
Good morning and welcome to the Board of Health for February 23rd, 2026. I am the Chair of the Board of Health, Ward 2 City Councilor Cameron Kretsch, and joining me today in the council chambers is Member Kirkby, Councilor Alex Wilson, Councilor Kassar, Councilor Mark Chattison, Member Jansen, and Vice Chair Joseph. And joining me online, Member Chung, Member Danko, Councilor Huang, and Member Safi. Welcome, everyone. Calling the meeting to order as we do have quorum. Just a quick note, we do have new procedures for how we're using the microphone. Turns out not very exciting after all, but I will just let you know that now you'll have to deal with me. I'm in control of the microphone. So if you want to request to speak, I can activate you. If you're online, that'll happen a bit differently. You'll just do what you did before. Mainly this instruction is for people who are in the chamber, and thankfully our legislative coordinator went around and showed everyone how it works. So next time you're in the chamber, remember to ask him how the new system works. Otherwise, we'll get the meeting underway. On to item number 2, the approval of the agenda. May I please have a mover and a seconder to approve today's agenda? Moved by Member Kirkby, seconded by Councilor Kassar. Are there any amendments from board members to the agenda for today? I'm not seeing any. All those in favor of the agenda, and it's a motion by hand, so all those in favor? That's everybody, thanks, that's carried. Are there any declarations of interest today? Not seeing any. So we'll move on to the approval of the minutes of our previous meeting. And that was from January 26, 2026, item 5.1. Can I please have a mover and seconder to adopt the minutes from our last meeting? Moved by Councilor Kassar, seconded by Member Safi. Any discussion on the minutes, amendments or changes? Okay, all those in favor by show of hands of adopting the minutes. That is everyone, that carries. And now we're on to items for information. And the first item for information, and the only one, 7.1, is BOH 26009, Orientation to Public Health Emergency Management. So I'll ask for a mover and a seconder to put the report on the floor. Moved by Member Jansen, seconded by Member Kirkby. And I'll look to see if there's any discussion. And first up, I see Councilor Huang. Take it away.
Chair, I'm not sure if you wanted to have an overview of this report first, because I have questions that dig a little bit deeper into the descriptions and the detail in this report.
Ultimately, honestly, I don't believe overviews are necessary unless somebody wants one. The report is on the agenda. It's been published in advance, so if people have read it and are comfortable with the content, if somebody specifically wants an overview, we can get one. I'll wait to see. No one's asking for one. So take it away with your questions, Councillor White. Thank you.
Thank you. Through you, Chair, just a question around emergency preparedness and the resiliency planning. How are we actually tracking that? And then what are some of the KPIs on how are we going to do better every single time we have any type of activation or as we shut down the emergency protocols? What's our feedback mechanism look like here?
Through the chair. I'm Chris Nagel. I'm the Emergency Response Coordinator. I authored the report. Thank you very much for the question. I think obviously learning from all of our past emergencies is one of the most critical things we can do during emergency response. So after every emergency activation, after every exercise that we do after action reports, and we track all of our corrective actions to make sure that we implement them. So we do have internal KPIs on any of our outstanding actions from all of our previous after action reports. So that's how we make sure that we're both tracking what we're learning from our responses, but also making sure that we actually follow through on them.
Okay, thank you for that. Second question through you, Chair, is a question on comparatives. So measles outbreak, for example, is not just a Hamilton-only type thing. But feasibly, it would enable an emergency response. So how do we track how we're doing versus what other municipalities are doing? Other than the very real metric, which is like number of measles cases coming down, but like it's just one of those things where I'd like to really understand, are we following along with best practices, or how are we doing in comparison to other municipalities?
Yeah, through the chair. Another great question. I think a lot of it comes down to just the networks that we build with our partners, our other health units. We have one just for emergency planners that we have a discussion board that we're always talking about what we're dealing with, learning from other folks. I know during measles, other health units were impacted a lot greater than us, like Southwestern and other ones. So there's a lot of discussion about learning what they did and then applying some of those locally. Anything you want to add?
Oh, good morning. Thank you. And through the chair, my name is Chris Pickersgill. I'm the acting director of Communicable Disease Control Division this morning, covering for Director Jordan Walker. And I can speak specifically about our measles responses over the past year or so, where each of them has been kind of unique. So the response itself requires a different level of service and response from our health unit. So when we do activate deployments, for example, from other programs, key among that process is to evaluate communication afterwards. We have conversations with the nurses who come over and support and how we can get better when it comes to communication, the deployment, but also ensuring that critical public health work is able to continue within the infectious disease program and then similarly across other programs.
Thank you for that. My last question is perhaps a bit of a higher level generic question, because I know we have several best practices and we're doing really well on several fronts when it comes to emergency and preparedness and action. However, are there any lessons learned that we can apply to some of the big crises we've also called for? We have a crisis of opioid addiction. We have a crisis when it comes to mental health. Is there any overlap or is there any opportunity to learn from some of the lessons learned in the emergency preparedness and resiliency aspect to apply to some of these big overarching crises? I know it's a very large and generalized topic, and I'm asking for perhaps an opinion on how we might be able to leverage some of those learnings.
Is there anything specific you were asking a question about, Councillor? I think that's a rather large question. I think the report tries to address that generally, but is there something specific you could narrow that down to?
I think that when I'm reading all of these reports, Chair, my thoughts keep coming back to the fact that this council and this particular term, we've called upon several crises, which is mental health and opioid addiction. All of this is that we have learned lessons around emergency preparedness, but I don't know how we can make them all work better together. And so I think that might be perhaps the crux of where my questioning will probably be today as we have conversations around the annual service plan and that sort of thing. So perhaps I am being a little bit too generic. I guess that just gives the leadership team a little bit of insight into where my head is at. But I'll take all of these offline because I think you're right. They are a little bit too generic right now and a little bit too large and overarching. Thank you, Chair.
Thanks. Notwithstanding that, Dr. Richardson has something she wanted to add.
I was just going to add, Dr. Richardson, Medical Officer of Health, just going to add the piece about the work that we're doing in the substance use area, where we're looking with partners across the community at looking at how do we respond to an increased number of deaths, for example. So an increased number of casualties that's related to the opioid supply. So I think Melissa may well talk about that briefly in just one moment. And so just drawing that thread through to that plan, as you were saying, Councillor. But it is an example of where we've taken that same kind of emergency response type scenario and applied it to that piece.
Thanks very much, Dr. Richardson. Next up on our speakers list is Member Jansen.
Well, actually, just to pick up on that question from Councillor Huang over here, I too had a question around, the report mentions that in 2018, the opioid response led the foundation for the drug strategy. Again, to those comments there, I know that we are still in a crisis. Are we still in an emergency as per the EOM here? Maybe I'll pause there for a second. Are we still in a formal emergency?
Through the chair, it is definitely still an issue that we're dealing with on a regular basis. In terms of like an official emergency activation, though, it was never officially declared emergency through the channels of the Emergency Management and Civil Protection Act. So in the city, we have me as emergency coordinator just for public health, but there's also an emergency management program through fire, and they oversee different legislation. And they deal with like the official emergency act or declarations. So in terms of that legislation, no, it's not considered an official emergency, although we know it is a critical issue that we're continuing to deal with.
Just ask a follow-up question then. What would be the threshold indicator situation that would lead us to say we are in an emergency? What would have to happen for us to call this an emergency?
Through the chair, it's a difficult question only because the way the legislation is actually worded. So legislation talks about that an emergency has to be, and I'll read you a little piece here, but it basically needs to result from forces of nature, health risk, or an accident. And these emergencies are meant for like short term. I think they have to be renewed every 30 days. And they don't actually open up any funding. So unfortunately, it's not like in the United States where if there's an emergency declaration, there's FEMA and a bunch of funds available. In Ontario, we're limited on what funds are actually available during emergency declarations, and most of them then have to be approved by the province. There is some eligibility for municipalities if their spending goes above 3% of the tax levy, but that's a pretty high threshold. And that funding is only for natural disasters, so it's not even applicable to a lot of other emergencies, unfortunately.
Okay, no further questions, thank you.
Thanks. I'm not seeing anybody else on their speakers list at this moment in time, and so we'll need to have a motion by a show of hands to receive the report. All those in favor? That's everyone. It carries. And we're on to items for consideration, of which there are two. Our first is BOH 26005, Board of Health adoption of the Code of Conduct. And just to let you know that we have the Integrity Commissioner, David Bogosian, joining us in case there's questions for him about this, and you have the report there. And there is also, I believe, somebody from the City Solicitor's office or the City Solicitor also available virtually if we have questions for the City Solicitor. At this point, I need a mover and seconder to put the report and the correspondence on the floor. And that's moved by Member Safi and seconded by Councillor Kassar. Is there any discussion on this topic? And I'll wait a beat because I know there was some discussion on this at the last meeting and people may want to weigh in on the Integrity Commissioner's correspondence. I'm not seeing anything. So this will require an electronic vote to approve the report and receive the correspondence. And we will go to the electronic vote now. As it's the first vote of the day, it'll take a little longer for it to arrive. When it's up, I will say so. On my end, it's a bit slow, so if anybody else has it up on their end, they do. Yep, it's up. I see your hand up. Member Danko, did you want to speak to this or did you want to just vote in favor? Okay, voting in favor. Okay, same with Member Safi. Thank you. I vote. No, I'm in favor. So some of us have clicked the vote and it hasn't received. The robots haven't handed it off. So manually we are at 11-0. That carries. Thank you very much. We're on to our second item for consideration, which is Board of Health 26010, which is the 2026 Annual Service Plan. Dr. Elizabeth Richardson, the Medical Officer of Health, Julie Prieto, Director of Healthy Families and Chief Nursing Officer, Kevin McDonald, Director of Healthy Environments, and Melissa Bixa, Director of Epidemiology and Wellbeing, are here to provide the board with a presentation on this item. The presentation will be approximately 15 minutes long, just letting everyone know. I'm going to have a mover and seconder to put the report on the floor. Get it up there, moved by Councillor Kassar, seconded by Member Jansen. So we will get that out there and get it on the floor, and then we'll let the presentation happen. And it'll be happening from the bench, so you take it away whenever you want, Dr. Richardson.
Great, thank you very much, Chair. So we're going to go through the annual service plan for 2026, and we're just about on the cusp of starting to plan for 2027. So we'll talk a little bit more about that when we get to the end of this piece. So just next slide. Brendan's going to change slides for me because my WebEx tends to crash, I realized, about 45 minutes into the meeting, every meeting. So thank you, Brendan. So the annual service plan is the final output of our annual planning process. We also do plans as well for other parts of our business, like child and adolescent services, alcohol, drug, and gambling service, and we kind of do those all together at once. But this is the product that actually is required by the Ministry of Health for programs and services under the Ontario Public Health Standards and under the Health Protection and Promotion Act. It goes into a single online reporting tool, which makes it a little bit cumbersome. And takes a fair bit of time to detail and enter in as required by the province. But it's an extensive overview, ultimately, of all of our planned mandated work for the coming year, and our program managers lead that effort across all our programs and services and give very detailed plans. It leads off, however, with an overall section on population health priorities, and so that's where you see that we'll be focusing today. And we do also do a performance report for you annually. It comes a little later in the year on the 2025 year. We'll be bringing that forward in, I think, about April or May of this year. But we do start to look at those metrics as we go through the planning for 2026 for the following year. Next slide. So this, of course, is our overall roadmap for our business planning cycle that we do. We usually begin in the second quarter, and we will do that again this year. You may recall that this little four-square chart at the top of the page, but it talks about all the different inputs that come into our planning process. So there is both population health assessment work, which is led out of our epidemiology and evaluation group at looking at what are the latest stats that we have around the health and well-being of our community, as well as some of those performance metrics that I just mentioned. We look at research evidence. Our teams are always keeping up to date on the evidence in their area. We think about resources and assets, so we always know there's more to do than we have the resources to do, and sometimes we're not the best positioned to do something that is needed out in the community. There are other partners who are already doing that work, or they can do it better than we can, or sometimes the research just points out that a public health approach is not yet developed for a particular issue, and so we wait to see and participate in research that could perhaps generate some sort of response. And then the other important part is our board input into the process. And the board represents that broader community input as well that comes in, although we do through our teams, we do different consultations with and have stakeholder groups that we work with. But last year, you will remember that Dr. Liu and I went around in about July or August of that last year, sat down with each of you and talked about your inputs into this planning process. So we do take that information then, share that through our teams to have input into their planning that they do, and then ultimately it feeds into the budget, which you just approved, of course, in January with the modifications that were made. And then we bring forward this report with the submission that needs to go into the ministry by March of the current year. I should note that next year, what we're planning to do is bring this submission forward with the budget rather than having two separate meetings so that they can be seen at the same time. But we'll finalize that approach as we get through the year. So as I mentioned, the annual service plan includes priorities that guide resource allocation. We need to allocate those to the most urgent and high-impact population health needs. These, of course, are priorities that are complex. They're long-standing challenges that require coordinated action across multiple sectors. Priorities are reviewed annually to ensure alignment with that updated data, as I mentioned, emerging needs, and the shifting community and political expectations. So from the conversations that we had with you last summer, we identified these themes. So the first of those was that the existing priorities were affirmed. These were still the key issues that were facing our communities. There was a desire, though, to see equity, which had been held as a single priority, to be integrated more so across all the priorities rather than being a separate one. There was also a very clear interest in Hamilton Public Health being more intentional about demonstrating impact, and I think we heard that from the councillor asking questions around emergency response already this morning, but a call for measurable outcomes, stronger accountability, and clear evidence of impact across all programs. There's an interest to have more clear, accessible communication to strengthen and build public trust, as well as raise public health and the board's visibility. And so you'll know we brought the communication strategy just last meeting. And then an interest in health and all policies in terms of working with other city departments. Just going to turn next to the context slide. And just a little bit of the overarching data behind the priorities that we're seeing. So children in Hamilton are experiencing challenges ranging from developmental challenges to mental health challenges, while at the same time, we're also seeing rising poverty, greater food insecurity, and the like. And so we are seeing declining self-reported mental and emotional health, and you'll see that a little bit further in statistics like what is on the EDI or the early development instrument and those sorts of things. In substance use, we continue to see over 1,000 deaths each year in Hamilton from a range of substances. These 1,000 deaths, though, are caused by particularly alcohol, tobacco, and opioids. And opioids have emerged as a top cause of premature death, or had emerged as a top cause of premature death, although this has improved since 2021. We're seeing increasing challenges posed by climate change, resulting in higher temperatures, air pollution, and increased spread of vector-borne disease. And so we're looking at issues that are higher in frequency and intensity, as well as duration. And issues like wildfires and heat waves, of course, are all part of this. And then finally, from an equity perspective, inequities persist in Hamilton and are a major contributor to poor health across all health indicators. They are, for local Indigenous people, they have also indicated a need for traditional healing and wellness, as well as access to housing and access to primary health care. So ultimately, in the next slide, you'll see here the priorities now focused around child and youth healthy growth and development, climate-related environmental health risks, and substance use prevention. And then we've changed the format to these foundational principles that really underscore or underpin all of our programs and services. And so equity-driven public health and upholding Indigenous inherent rights, as well as the importance of working on organizational capacity. And so you'll know that we have talked a fair bit about workforce flexibility, and being an adaptable and flexible workforce has been absolutely key in terms of being able to continue to respond to things like measles, while also ensuring that we can continue other programs in the area of school programs, chronic disease, those sorts of things, rather than reallocating resources on a broader scale. It also means that for any larger scale activations, our staff are trained and ready to act across their full scope of practice in areas particularly related to communicable disease control. And then, of course, the use of technology. As things change rapidly on this front, we know that this is a key way that we need to look at our business in terms of whether it's communication or in terms of efficiencies, and looking at how we can improve customer service as well as staff satisfaction. This will be an absolutely key thing as we move forward. So with that, I'm going to turn it over first to Julie, who's going to speak to child and youth, and I'll just ask each of the presenters then to hand it over to the next one as we go.
Okay, thank you, and good morning, everyone. Julie Prieto, Director of the Healthy Families Division and Chief Nursing Officer. So the goal of the Child and Youth Healthy Growth and Development Priority is to foster equitable and culturally safe, healthy growth and development among youth, children, and to build the foundations for lifelong health and well-being. So on the slide, you'll just see a few snapshots of the priority work for 2026. So to contribute to this goal, we are strengthening systems and fostering safe, stable, and nurturing relationships that build resiliency for pregnant people, infants, children, youth, and families. One of the ways we are doing this is through strengthening perinatal mental health. A perinatal mental health conversation guide has recently been developed in collaboration with community partners. The purpose of the guide is to support social service providers to have conversations about mental health and how to access resources with parents and caregivers who are expecting or caring for an infant up to 1 year of age. Another area of our work under this priority focuses on improving oral health among priority populations. We are doing this by tailoring oral health preventative programming for young children who are experiencing challenges to accessing oral health because of financial, cultural, language, or other barriers. To improve access to care, the dental program is providing community-based screening, fluoride varnish application, and oral health promotion activities. The program will also expand delivery of mobile preventative oral health in schools in priority neighborhoods. I'll now turn it over to Kevin McDonald.
Thanks, Julie. Through the chair, Kevin McDonald, Director, Healthy Environments, Hamilton Public Health. In the interest of brevity this morning, this priority focuses on fostering healthy built and natural environments that protect and promote health, reduce current and emerging risks, and ensure coordinated, effective emergency management, which Chris Nagel pointed to this morning. For the coming year, new efforts emphasize strengthening public communications, as Dr. Richardson alluded to in her earlier slides, to provide clear and practical information that aids residents and visitors in safeguarding their health. A case example in terms of vector-borne diseases, a multi-channel tick awareness campaign entitled Don't Let the Tick Stick is being launched to increase public understanding of vector-borne disease prevention towards the reduction of risks associated with tick-borne illness. That will occur in the second quarter of this year. And in furtherance to the City of Hamilton's community heat response strategy, Hamilton Public Health staff are enhancing heat-related education, outreach, and engagement with community partners and the public throughout 2026. This spring, we will begin publicly sharing heat-related illness surveillance and population health assessment data specific to extreme heat. This step is innovative and it improves transparency and public awareness around the impacts of extreme heat in our community. And finally, in collaboration with our municipal colleagues from the Office of Climate Change Initiatives, coordination of the community heat response strategy will gradually transition to OCCI to reflect the citywide scope and inherent City Council approval requirements that are associated with the various tactical components of that strategy. And with that, I'll turn it over to my colleague, Melissa Pieksa.
Sorry, apologies. Good morning, Melissa Pieksa, Director, Epidemiology and Wellbeing. So to briefly highlight the substance use prevention priority, in 2026, this priority will highlight public health's unique role in addressing upstream factors that influence substance use and related harms in the community. Through the substance use priority, we will aim to prevent substance use-related health and social harms in Hamilton by both addressing risks and strengthening supports for individuals and community. Some examples of this in 2026 include working with community partners to increase outreach capacity and strengthen coordination to provide low barrier support for our underhoused individuals who have recently experienced a drug poisoning in the community to further connect them to health and social supports. In addition, from a substance use prevention piece, in 2026, we'll focus on implementation of a youth nicotine strategy that will include a comprehensive set of interventions to prevent smoking and vaping through interventions such as training new youth to lead peer-to-peer activities, campaigns that are developed with youth, programming in the community and schools, and advocacy for legislative changes.
Thank you, Melissa. Okay, and so equity-driven public health and upholding Indigenous inherent rights is a foundational principle, which means that health equity is integrated across the priorities. This principle focuses on strengthening Hamilton Public Health's capacity to address health inequity in all of our areas of work. Part of our work under the principle also includes internal, ongoing work to ensure equity is embedded across the organization to guide decisions, policies, and daily practice. In 2026, all staff will have completed foundational SANIAS, Indigenous cultural safety, and local context training, along with health equity and anti-racism training and trauma and violence-informed care training. In 2026, we will update the learning strategy to ensure training is sustained and offer continuous learning and reflection opportunities for all staff. Also under this principle is work that aims to enhance the collection and use of social determinants of health data to deepen the understanding of local health inequities, identify root causes, support informed decisions, and drive collective action. This includes our work on Indigenous data governance. So Hamilton Public Health is actively engaging with Indigenous community organizations to determine how Indigenous data and information is used in community health status reporting. We are respecting the principles of Indigenous data ownership, control, access, and possession. One example of this is engagement that is ongoing with Nawasa Kindaswa and TAG, which is a multi-service Indigenous organization, to pilot an example of an Indigenous-led community health status reporting product. I'll turn it back over to Melissa.
Apologies with my slow microphone this morning. Thanks so much, Julie. So now I'm going to turn to, as Dr. Richardson highlighted earlier, our newest priority area for 2026. The organizational capacity principle and priority is a new addition for 2026 and reflects the reality in which we work with potential for technology to play an increasing role in service delivery, while at the same time having finite resources to respond to a range of public health issues. These priorities will continue to focus on a flexible and adaptable workforce, which aims to ensure that Hamilton Public Health has the necessary organizational capacity required to effectively respond to surges in operational demand, such as during public health emergencies, while maintaining essential public health services. In 2026, this will include developing and operationalizing policies and processes to support competency development and operational surge capacity for infectious diseases case and contact management, while building on lessons learned from previous public health emergencies. In addition, in 2026, around the enhancing service delivery through technology, public health will continue to strengthen the internal use of technology to improve client experience while safeguarding privacy. At this point, I'll turn it back over to Dr. Richardson.
Thanks very much to my colleagues. Just to reiterate, the next step from today is that this annual service plan will ultimately be submitted to the province, and then we will start the planning cycle for 2027. And so this year we'd like to start with the meetings with the members earlier, so see something more so in March so that we can have some input earlier into the planning process, as my colleagues will be underway again in the next few months. So we plan to send out an email in March and meetings to happen in April, and so hoping that works for people's calendars. Happy to take any further questions.
Thanks, and we do have a speakers list, and first up is Councillor Tattison.
Thank you, Chair. I have a question for Director McDonald in terms of the climate-related environmental health risks, and it says basically, from my readings, to build preparedness for more frequent and intense extreme weather events, Hamilton Public Health also partnered with the city's emergency management program to conduct an extreme heat tabletop emergency exercise. I'm just trying to get an understanding of the city's emergency management program. Is that something inside of public health or beyond that with the entire city?
Through the chair, thank you very much, Councillor Tattison, for the question. The short answer is it's beyond. It sits within Hamilton Fire Service with Chief Dave Cunliffe. We have an emergency planning coordinator, Chris Nagel, who you were introduced to this morning. And so when specific types of emergencies or incidents conflate to involve and bring to bear public health resources, Chris comes to the table. But we work closely with our colleagues within the municipality in terms of any public health implications associated with a given incident or condition.
Okay, thanks for that. And I have one more question. It relates to your office, public health, and our city's climate change office. So can you share how the city's climate change office informs public health actions, or how public health assists the climate change office with their actions? For me, I see the city's climate change office has an annual budget of $2.5 million. Perhaps maybe public health could tap into that. Can you expand on the working relationship between those two bodies?
Through the chair, thank you very much, Councillor, for the question. So as you will recall, public health had a really foundational role in the establishment of the Office of Climate Change Initiatives under now the direction of Dr. Linda Lukasik. And Trevor Imhoff was one of our staff within public health. He is a senior manager within that office now. The Office of Climate Change Initiative has a much broader mandate. Our focus in terms of climate impacts looks strictly at environmental health impacts on human health. And so part of our work is embedded within their larger climate adaptation plan, and you will see that in their annual reporting year over year. You will see these issues that have been outlaid in this report, for example, in terms of extreme heat response, wildfire response, vector-borne diseases. Those are reflected as well in terms of overall risk and emergency management for the broader city of Hamilton. Our office is not involved in the broader climate mitigation adaptation planning, albeit we do help to inform through some epidemiological data and data that's available to us some of their work around reducing carbon emissions, and the annual energy and emissions plan, for example, does not uniquely involve our office.
Okay, thanks for that. I'll take that question further up with our climate change office. Thank you very much.
Thanks. And before I let Councillor Taddison go, I think an inherent question in what Councillor Taddison was asking also was about our emergency operations center. So what happens that we see as councillors is suddenly the emergency operations center gets activated, right? It doesn't feel very fire-ish, if I can say it that way, when that happens, right? So could you maybe unpack that?
Through the chair. So when it comes to emergency operations for the city, it is a requirement that they have a coordinator. There's the whole set of legal requirements that Chris was speaking to earlier around under provincial legislation. And so we have to find a home for that somewhere within the city in terms of who hosts it. Sometimes in other municipalities it's hosted within the city manager's office, for example, but often you find it within fire because they have a focus that is related to that type of work, and they are often called upon to play key roles in those sorts of responses. And so that here in Hamilton, that office resides within the fire department, but serves and coordinates on behalf of the city as a whole. For public health, we have a specific mandate that is given to us under the Health Protection Promotion Act and under the Ontario Public Health Standards. And so we also have an emergency planning coordinator, which is Chris, who you met earlier today. And we do work with the municipality and coordinate with them, as well as with emergency planners within the health sector within Hamilton, and with emergency planners in the public health sector across the province, including the Office of the Chief MOH.
Thanks. I think the extra clarification was helpful. Hopefully, Councillor Taddison. Next up on the list is Vice Chair Joseph, then Councillor Cassar, and Member Kirkby, then myself.
Oh, hi. Thank you. Thank you for the report and the presentation as well. My query is about the priority that is titled Substance Use Prevention. I'm confused by the title somewhat in that the report on page 5 says, and this is a quote, "The goal of this priority is to prevent substance use related health and social harms in Hamilton by addressing risks and strengthening supports for individuals and communities." And also further along in the report, there's a comment on addressing upstream factors, and also the language of prevent substance use related harms is used again in the final paragraph. I read it as the priority being the prevention of substance use related harms rather than substance use prevention. And those to me are very different kinds of things. And I think evident in the report itself. So I'm wondering about the choice of wording there and if maybe there's an opportunity to amend it to realize the actual content of the report in the title.
Through the chair to the vice chair, thank you very much for the question. Appreciate the thoughtful reflection there, Vice Chair. And just for a moment to speak to those two pieces that you highlighted, one around substance and public health's unique role in the health system, I would say. So one is truly around substance use prevention. When we look at upstream approaches that start foundationally in the early years around effective child and youth healthy growth and development, work that we're inherently doing to prevent initiation of substance use around youth and young adults, where some of our areas of focus. The second piece around prevention of substance use related harms, again, I would say is a unique role that public health supports within the health system through our harm reduction mandate. That includes distribution of harm reduction supplies to reduce distribution of naloxone. So to reduce some of those continued harms associated with the use of substance. It also taps into some of our mandate around surveillance and the work that we do with our early warning systems to continue to communicate the local, circulating drug supply and some of that ongoing communication. So inherently, I would say from a public health perspective, it is both for us around prevention of initiation and preventing and reducing substance use related harms.
Thank you. So I assume that's agreement. Is it possible then to ask for that amendment to the title to include that component such that it doesn't only represent the first?
So through the chair, what's up for amendment by committee is the recommendation itself, not the body of the report.
So if I understand that, it's about the work itself, not necessarily the title. I think what you're suggesting is that maybe it's longer, because I think substance use, I'll have to just go back in my slides just one moment to make sure I have this correct. Substance use prevention is the current title, is that right? So you're suggesting maybe it's more inclusive so that it also talks about substance use and substance use harms? I'll say this. I don't think we're gonna wordsmith it right now. Maybe. I'll turn to folks on the bench if they have a suggestion as to how they can make that clearer. But yeah, did you have something you wanted to add before we did that, Dr. Joseph?
I think it's important in that very often we come back to priorities in terms of their title. They get shown to us on slides, in little bubbles. We allude to them in other discussions. And if we do so with the omission of the important component that was raised by me and also affirmed by staff, I think there's a potential to overlook it. And I'd rather address it in the priority title itself, such that it is named and spoken about and every time it's raised.
Right, so I think what you're implying, if I understand, is like, for instance, if we had just used the title substance use prevention, that might very well just fall under child and youth healthy growth and development, because that might be the inference, right, that we're just talking about that initiation. So I'll turn to Dr. Richardson.
Through the chair, if there's a desire to look at the title and agree it does capture, like it's meant to capture both areas as Melissa outlined, we could change it to prevention of substance use and related harms.
Yeah.
Great. It doesn't require a motion, by the way. We're just chatting. This is not a motionable thing. So thank you. It seems like we're going to do that. Did you have any further questions or comments you wanted to make? Okie doke. We are now on to Councillor Kassar.
Thank you, Chair, and thank you, staff, for the presentation. I'm supportive of the recommendation. I just have some questions. I wanted to focus in on child and youth healthy growth and development, which is covered in the presentation. And in the report on page 3, I'm just going to go to that. There's a section that reads, secondary school students report declining mental health and emotional health along with reduced sense of school belonging. So that's in the report. I just want to understand, is there any action in the work plan specific to that statement? Because it's a pretty foundational statement that has, I would say, impacts. This would be upstream, as was just pointed out, to maybe further challenges downstream of substance abuse or other things. So are there any actions around that about high school age kids and mental health?
Through you, Chair, to the Councillor, Julie Prieto, Director of Healthy Families and Chief Nursing Officer, and thank you for the question. So certainly as we sort of, look deeper into the plan, there are some specific actions, I would say, about addressing overarching resiliency, social connectedness, and some of those foundational pieces that we know really support healthy mental health and healthy growth and development. And certainly that work starts not just at the secondary age, but earlier on at the elementary school age as well. So, excuse me, we have ongoing partnership with our school board partners where we have a shared action plan. We're a couple years into this work and it's working really well. It's where our sort of leadership works with school board leadership to identify shared action items. And it's really around partnering with them to appreciate what's happening sort of at the schools. We're providing some of that population health assessment data, like identifying some concerns around mental health for the adolescent population. Excuse me, specifically with the high schools, we have nurses supporting targeted schools and identifying really at the local level what those issues are. And some of that is happening through engagement with youth. So it's, sorry, I apologize. It's really working in school by school to address what are those issues, how to increase things like social connectedness, how to address things like substance use, how to build foundations like resiliency. And so we will continue that work in 2026 and working on the 2026 to 27 school plan as well.
Okay, thank you. Through you, Chair. Thanks for that. Just wanted to drill in on that a little bit because I've spent some time trying to understand this topic more. I have, well, they're now no longer high school. They're older than that, but spent some time reading and researching around the impact of personal devices, cell phones, tablets on mental health and social media. Turns out there's a lot out there. Research has been done that's quite convincing that there's been a strong shift away from personal interaction and play into the virtual world where there's weaker connections and relationships, then kids and youth do not develop skills. I think that's really fundamental, and there are other jurisdictions that have taken steps, Australia, for example, around social media. That's one approach for it, but that's not that I can see in this work plan. So I would just, and I know there'll be conversations, as Dr. Richardson said, going forward, but I'd just like to understand the city's take on this at this point in time, or in the province. Is there thoughts, is there actions underway? Just if you could give some kind of sense on where we're at on this topic, because I do think it's very significant. Through you, Chair. Thanks.
Yeah, thank you. And through you, Chair, thank you again for a question. And certainly, absolutely, this is something that we're looking at because we do appreciate that excessive screen time, use of social media can have impacts on physical health, cognitive health, emotional, mental, and social health as well. And so one of the things that we're looking at quite closely is a screening tool to see if there's ways in which we can screen and look at healthy screen time. So we currently have a project underway that's starting with a in-depth review of the literature. One, to really hone in and understand what are the impacts of excessive screen time, social media use, and AI as well. So if we understand what those impacts are, we can appreciate potentially some of the interventions and recommendations. And again, the other piece really looking at is, are there screening tools that could be implemented early on to identify concerns around screen time? So we're going to take what's in that literature review is almost complete. So that was what we were working on for the first quarter of 2026. And with that, looking at some of the recommendations that will come out of it. From there, the plan, of course, would be to work with our school partners around implementation of those interventions, but certainly recognize that screen time is absolutely having an impact on healthy growth and development. And again, it's not just, it's mental health, it's social health, and it's physical health as well.
Okay, that's encouraging. I'll likely follow up offline, but that's all for now. Thanks.
Thank you very much, Councillor Kassar. Next up is Member Kirkby, followed by Member Jansen, and then myself.
Is it on? Yeah, with the new system. Thanks so much for the report. I'm just curious, going back to the climate action priority, just how prevention or the more kind of upstream approaches have been considered within that priority. So going beyond kind of mitigating the health impacts. So can staff provide some more detail related to how public health plans to reach its goal to promote the healthy built environment or healthy built and natural environments related to climate action? And how is public health engaging with other city departments, so transportation, planning, to really inform the work that they're doing from that public health perspective?
Through the chair, thank you very much, Member Kirkby, for the question. It's a very good one. Our office is very connected with city departments in terms of the work in this area, not only planning and economic development, but public works, as well as those uniquely situated within the Office of Climate Change Initiatives. And so you're absolutely right. This work does reach far beyond strictly communicating information and raising public awareness about the salient issues. So in terms of how we work through this particular issue, if we're talking about vector-borne diseases or extreme heat, for vector-borne diseases, for example, we work very closely with our colleagues in environmental services and public works to talk about green spaces, naturalized areas, what is being done in that regard to help mitigate and reduce the overall impact of ticks, for example, in terms of them being endemic in this community now. So we do that work there. We are working very closely more broadly on the built environment with our colleagues in planning. I think last year we reviewed and commented on over 70 planning applications and reports, looking at that through a public health lens, working very closely with planning staff in terms of the implications of some of the work that's going on in terms of development and construction in the city, for example. We're also working very closely with the Office of Climate Change Initiatives as it concerns its broader climate adaptation plan. And we do help to inform that plan, and they report on that on an annual basis. So there are a number of touch points within the municipality, but also more broadly in terms of the community as well. Not only community partners, advocacy groups, concerned citizens, but also industrial partners as well through Cleaner Hamilton, for example. So we are working with a number of different groups to look at more upstream solutions to these issues. Certainly, much of our focus the last couple of years has been on emergency preparedness, given the prioritization within the Chief Medical Officer of Health's office here in Ontario for emergency preparedness. But the conflation of many of these impacts, such as extreme heat, wildfire smoke, for example, and all that means in terms of our built environment and natural environment. And so I don't know if that fully answers your question, but I can certainly take it offline with you and provide you, more detailed. What I am pleased to report is that, in this area in the province, our staff within vector-borne diseases and health hazards are widely regarded as leaders in this area. We saw that firsthand when we did the pre-heat season meeting last year, when Hamilton and largely Toronto were largely sought after to share what had been done in their respective communities in terms of preparation. And so we find that encouraging.
Yeah, thanks so much. No, that's really helpful just to get more details around that, as it wasn't reflected in the report. Thank you.
And I should say before I turn to Member Jansen, there are 3 ways to know that your microphone is on. I'll tell you what those are because I didn't say those before. Number 1, usually what happens is you appear up there when your microphone is on, just when it starts getting activated. Number 2, the red light comes on, and it's just on the collar here, so it's hard to see when you're sitting there, but if you lean, you'll see it come on. I'll show you when I do it for Member Jansen. You'll see his light come on, but there's yours, Member Kirkby, just for fun. And the third way you'll know is your name will disappear from the screen. So in front of you, you'll see your name is in the queue. When your name is removed from the queue, it means you're able to speak. So that's how, just letting you know, because it is tricky and you're trying to follow along. Okay, Member Jansen, you're up.
Wow, there you go. Okay, thank you. Through the chair, maybe this comes down to me still being the newest member of the table, I believe, or one of the newer ones, and maybe this comes down to process. What I'm still just hoping to try to do is draw a through line between what I'm reading here, which are very high-level objectives. I saw words like snapshot priorities and things like that. These are very high-level objectives, but to draw a straight line through those objectives to concrete goals, specific strategies and tactics, concrete measures for how we're actually seeing the needle moving forward. And I'm listening to some of the conversation around the table here and thinking the details are in those specific strategies and tactics. The difference between substance use prevention and the prevention of harms related to substance use caught my eye as well. It's an important strategic difference, a very important, you know, there's different literature based on those 2 different strategies. My question is specifically is there another document that we're waiting to create that draws that through line from these high-level objectives all the way down to specific concrete measurables? Will that come out in the process later? Some clarification on that would be helpful. Thanks. Through the chair.
Through the chair. So as I mentioned earlier, there is a very detailed tool which contains that information, and that's a tool that the ministry provides that we do our planning within. And those kind of operational details that take us down through those levels are entered into the tool. So generally the annual service plan, what we bring here is the priorities themselves at that level and with some exemplars, and then we bring some performance metrics as well later on through the year. But the details of all of those pieces are within the tool, and it's virtually impossible to produce a written version, and it's not possible to share that electronic version. And so that's where those levels of the more operational details are. And at the board level, we focus on the overarching priorities and then look at the performance under them.
Maybe just as a comment there, just where my mind goes is there's a lot of conversation about continuous quality improvement and the role of the board in ensuring some of that CQI and quality assurance pieces as well. And I think that comes down to some of those operational performance indicators. And I'm just curious about how we're able to maybe this again is a conversation we can take offline, but that's where my mind goes around, how are we concretely measuring change? How did we connect these high-level objectives to those measures? But again, maybe those are conversations offline. Thank you.
Through the chair, to begin on that front. So I think, again, much of the CQI that happens in our programs and services happens at the staff level. And so it is work that is done. You may have seen a video that was recently released by the city manager talking about how their frontline staff have that information to drive the CQI. At the same time, we do continue to monitor that across all of our programs and services and look at continuous improvement throughout the organization. And so that's where some of those metrics come in with our performance reports. You mentioned as well in terms of getting some of those pieces together. And so we'll be bringing forward, I had made a mention at our last board meeting about us bringing forward these program updates that will come forward. We're going to trial them with you for the next, for April, May, June, and July and August. So there'll be 5 that come through on specific program areas that will give you an opportunity to understand more about what we do, the breadth of the programs and services. They'll lay out the resources that are invested in those, and they're going to give you some of those metrics specific to that particular initiative. So knowing that's part of what is desired to have, We can't possibly do a deep dive on every program in a report such as this, but this will give a chance for the board to look at those pieces, see if that's meeting a need that is out there, refine it as we go forward, and decide where to go from there.
Thanks very much. And I think also something just to reflect on is that what this Board of Health is now, after it's gone through 2 legislative iterative changes, 3 in the last 2 years actually, is also responding to its own history. So sort of the way that we format things, the way that we do things, the way that things are reported here, it was all designed to be reported to council under different legislation. So I think one job we have this year, I'm taking this job very seriously, is how do we figure out what we're doing here and what our authorities and powers are? Because actually we have more powers and authorities here in a way, and sometimes different. But what are those, how does it work? And if we need reports to look different because we are a different audience and we're responding to this differently, that's advice we can give to staff through that process, right? Is saying, hey, what can this look like? How can this be more helpful? Because many people in the room are coming at this from the perspective of their own professional experience in the field, right? And so they're used to seeing what this looks like as public data, but this was an activity designed for council, to be honest. So that's a different activity. And so we're gonna make our progress with that. And everyone has a role here to play. So when you have those meetings with Dr. Richardson and everybody else, make sure you give as much advice as possible. On that point, next up on our list for speakers is Member Safi. You just unmute yourself and go ahead whenever you're ready.
Thank you. Thank you very much for this. This is for Dr. Richardson also. Regarding all these services and strategies, I think one of the challenges is how accessible in terms of like navigation wise to the public it is. In other words, is there, I understand, for example, on the perinatal health, if a woman says, I'm looking for perinatal health, mental health support, it will mention on the website maybe the inspiration from the city of Hamilton. But how we can actually make the website in a way where people would ask a question specific to their situation, and they can find all the resources available in the city, either through NGOs or through nonprofit organizations or through the city. For example, a woman with kids and they don't have food to eat, and they're really not aware how to find out the food bank. I know that there's lots of pressure on food banks. A person with perinatal challenges in terms of health and mental health, they might not be aware. I actually even ran out into healthcare worker that they are not aware about service in the West Fifth for perinatal depression for women. So how we can make the website friendlier for navigation for people, where the need is written easily and it's found easily for people to see their options. So I'm not sure if this is clear. I hope that clears it.
So through the chair, I'll start in terms of giving an answer, and then I'm going to ask Director Prieto to answer as well. So I think one of the challenges we're having, across the community is who hosts what information where. And so, we know from a healthcare professional standpoint, for example, within primary care, they've developed already hundreds of pathways now, and we're participating in those that are available through a single website for practitioners so that they can see, how do we link, what's the care we can link people to? What are the different services that are available? What's out there? On the public side, we have organizations, and I'm forgetting the name of it, but there's organizations that pull all that information together in a database. And so, you can find it there. Our website's never been meant to be the one that does it for all of the services within the city. It's only meant to do it for the services that we provide directly, knowing that there are others who are pulling together those databases elsewhere as we go forward. That said, I'll just turn to Director Prieto, because there's some of the work that we've done on pathways as well that are more community-based that is helpful to this too. So I'll turn it over to Julie.
Yeah, thank you for the question. And so just thinking about that perinatal guide, for example, So again, the intended audience really was community services. And so there is a table that convenes that has representation from community organizations that provide support to pregnant individuals and families. And so the intent really of that guide was to just provide sort of a single infographic essentially with information around services that are available in the community to support perinatal mental health. So from a dissemination perspective, I mean, the guide was created again at a table that had public health and community partners around. And really the table is taking on the responsibility of dissemination of that document into the community. But as Dr. Richardson indicated, it's hard for us to take on the responsibility of ensuring that our website sort of has information around all services that exist in the community. And so we do a little bit of that work through other things like community tables, like making sure that we have good connections into the organizations that touch upon our priority populations. And that there is, good understanding amongst those partners of how to support individuals and how to connect them to resources in the community.
Okay, thank you.
Thanks very much. And I would also say that when the city was undertaking an exercise a couple of years ago with respect to its website, it was a major activity. And so if there's some desire from the Board of Health for, as part of our communication, to undertake some kind of major activity with respect to website communication, we'd have to do that, cost a budget for it, et cetera. So I think that's something to think about, right? Again, when we're having these conversations about our priorities, our budgets, our action plans for the year, if you've got ideas like that that you think are a central priority to our communication, then that's something to talk about, right? I know other public health units do things differently. So go out there, scour the internet, see what you love, and we'll talk about funding it. Next on the list, Councillor Huang.
Thank you. Sorry, Chair, I was double booked today, so I had to be in two places at once. So I hope my questions haven't been asked, but I have three separate and distinct questions. The very first one is in relation to what I had asked earlier in the resiliency and emergency preparedness. Really, the question boils down to the City of Hamilton has declared several crises: homelessness, opioid addiction, intimate partner violence. So how does the Board of Health in this annual service plan participate or contribute, perhaps as a leader, perhaps as a core component, to helping and pushing forward those crises to get to a point where we can say measurable results on something like that?
Yeah, to a certain extent, I think that was Member Jansen's question from earlier about how we look at outcomes and how they connect. But if you have anything further you wanted to add, Dr. Richardson.
Through the chair. And so when we think about those crises, public health has relationships that are different to each one of those different pieces. And so, when we talk about homelessness overall, generally our push is through that resilience building that Julie has spoken much about already today. And looking at early years, those sorts of elements of it. But it's also through substance use and the specific opioid piece. And so we tend to look at those not through sort of annual plans such as this, but through topic-specific reports that look at those particular issues. So you'll know that we have now a semi-annual update around opioids that comes through. We've had different frequencies at different times. So there's going to be one coming back through in May or June of this year that will look at the evaluation of the HOPE plan, for example, the Hamilton Opioid Action Plan, which the drug strategy looked at. It's going to look at more detail in terms of the programming and where it's going. And so through those sorts of initiatives, council can look at council did look at where it wanted to go, and this board can do this going forward. So in the past, as council, for example, when we were looking at opioids, we developed through the opioid working group of the Hamilton Drug Strategy, the Opioid Action Plan, and council added significant funding, just under $1 million, I think it was at the time, related to those, and gave us sort of broader direction in terms of how to invest those dollars and then specific direction. So I think it is more so through those topic-specific elements that we can continue to look at those. And as I said, the opioid one will be upcoming.
Okay, thank you. My second question through you was, I am thankful that the second, there's 3 boxes in that slide. The second one was around climate change and adaptation. And Director McDonald knows that we're on his case about soot all the time. So I wonder, how does your service plan also align with, say, government advocacy and other orders of government? Because a lot of that work does require significant coordination and collaboration with Ministry of Environment, Conservation and Parks. It might also be appealing to other orders of government for additional funding. So how does advocacy kind of factor into some of your service plan work?
Okay. Through the chair. Thank you very much, Councillor Wang, for the question. It's a good one and a complex one. In terms of our ongoing operational relationship with upper orders of government, so the Ministry of Environment, Conservation and Parks, as an example, we have good established working relationships with the Hamilton District Office. There are elements within the Health Promotion and Protection Act that frame that relationship and how we work with them on specific types of incidents that they are responsible as the regulator for. And so you've seen those examples in terms of reports back to council, in terms of exchanges between their office and our office providing a public health interpretation of some of their data findings, for example. Staff are constantly working with provincial counterparts to identify and capitalize where possible on different funding stream opportunities as it relates to the work that we're doing at the local level. And often that work at the local level serves as a platform to inform what's going on at upper levels of government and broader community. And so in those areas, I think it's relationships that are really critical. It's understanding what our role and jurisdiction is pursuant to the types of issues that are coming forward and how we can gently encourage in many areas. The issue around advocacy is a difficult one. That is one that the board is certainly in a position to do in terms of calling upon upper orders of government to take certain directions or to change certain directions. We do, as a staff group, comment, for example, on proposed legislation, regulatory change at the provincial level through the Ontario Registry. And we do that through reviewing the salient issues given the item, things that have come before council and the prior board before, for example, site-specific standards, things of that nature, where we're doing our best to reflect what the earlier board council's direction was in terms of preferred policy options for different sectors and for the City of Hamilton, if that's fulsome enough.
Thank you. Chair, I do have one more question, if that's okay. So thank you for that, Director. It's something that obviously I'm going to continue to push you on and see if we can possibly collaborate further to try and push the agenda envelope, push the needle, all of those analogies to try and push this forward. My last question is on slide 4 when it talks about engage on health and all policies work. And this is something that I've actually talked to Dr. Richardson about because I've asked her about like, how do we do that? Because as now we are a board of health that is separate and distinct from City Council, how do we do that work across all of city departments in order to have those sort of tenants in place, but also how do we show the economic value of this health and all policies? Because we just finished budget and it was grueling and it was something, but like as we're moving forward, how do we talk about this in a more holistic way in terms of how we determine policy?
Through the chair. So it's something, we've been talking about since those conversations about, how do we go forward? And you had raised it now as well. Councillor Cassar had raised that during discussions. And I think there's a couple of things to think about. The first that comes to mind when you said that about engage with all of it is we're little and the city is big. And so, I think that we have to be careful that we choose what we're going to focus around in terms of addressing those particular issues. I think there are, as you heard from Director McDonald already this morning, there's a huge level of integration that goes on between his area and many areas of the city. So whether that's municipal law enforcement or OCCI, the Climate Change Office, there is a lot of engagement looking at things together. And I would say in the community safety and well-being perspective, that is a big area where that kind of collaborative work can go forward. Is that exactly the same as health in all policies? Not exactly at the same time. And so I think that's where, as we move forward, to have a bit more of a discussion at the senior leadership level about, what does that look like from a city perspective, and looking at health in all policies. That is something that would help to then look at where to focus those particular resources. What areas of practice and policy would we want to look at from that standpoint, and then focus those efforts further and be a little clearer about the lens that we're using on it.
Okay, thank you. Those are all my questions. Thank you.
Thanks very much, Councillor Huang. And I'll pass the chair to Vice Chair Joseph. I just had a few things to highlight myself. Well, I noticed one of the snapshot priority work was the heat response strategy, which is great. Been very vocal about that. What that tells me or reminds me of, though, is the situation we have in the reverse. So when we developed tools for our bylaws for individuals living in apartments who would end up having their temperature be too low in the winter, we developed a winter response there. And then conversely, we had to eventually adopt and develop a maximum heat bylaw strategy, which is the other side of that. When I see a heat response strategy, I'm also thinking about a cold response strategy, right? And so is that something that falls under public health, or could it in the future, is my question, generally speaking.
Thank you, Chair, for the question. So historically, public health had a very specific role in winter cold response. Given the principal providers and the types of programs and service provisions associated with that specific response and the unique vulnerable populations that response serves, Housing Division has become the point of the spear, so to speak, on that. In terms of coordinating and coalescing, they also are the principal municipal funder of many of those service providers in terms of expanding that. We did play a central role in strongly recommending that you move to a seasonal strategy around winter response, because what we were seeing in terms of members of the public and decision makers hanging on cold alert triggers, for example, we know that people living rough outside, people living homeless, those without the ability to seek warming centers, for example, those are critical, and it might not meet the threshold set by Environment Canada. Those are occurring much earlier, right? And so our principal role has been in the coordination of the heat response plan, given some of the core elements within that. And as this governance has evolved, we're also looking to the Office of Climate Change Initiatives to play a more central role in that, in terms of reporting back, given, as I alluded to earlier, that a number of the tactical components in that City of Hamilton heat response plan, and it is a municipal plan that was adopted, are embedded tactically in city departments. And so for our office, we do not have the authority or oversight to be able to direct different departments. And if there were changes or adjustments to any particular tactical component of that plan, I would look to my colleagues within those city departments, the senior leaders, to bring that forward to the respective, I would suggest probably GIC through the climate lens, in terms of what's needed to best respond and support residents and citizens here in the city of Hamilton.
Thanks. So just comments left for me. I think what I'll be focusing on as we look at our 2027 plan is how to get some teeth to help with certain things that are happening, or find ways for the legislation to support what the city's doing or what we want to do here. One of the areas where I think we're struggling as a city is around a number of what I would consider to be health concerns the public feels are important. So an example would be the shunting yard issues over at the CN rail yard there, with the toxic diesel fumes. Now, people from the Ministry of the Environment, Conservation and Parks get a complaint. Then they go out and they test the area for the complaint to see if it hits certain emission targets. We already all know that the provincial emission targets are not great. Those are my words. And, depending on dissipation, atmospheric conditions, all kinds of things, maybe it doesn't meet a certain kind of threshold. Well, what's the Board of Health or what's the public health response when it comes to people vomiting, having red eyes, headache, nausea, all other kinds of things that are happening as a result of these things meeting the threshold that's acceptable, right? Like, when we have a property standards issue in an apartment building where an elevator is out or water is out, right? What is public health's role in that kind of situation? Because I think what we're doing to a certain extent is we're working with other departments, but we're deferring to some extent our authority sometimes, right? So how can we work in conjunction with this? Like, could there be systems set up where it's like, well, when the city sets an extreme cold alert, right, then the public health does X, right, also, to strengthen something or strengthen what the city's already doing? Are there legislative tools we have available to us to do that kind of thing? Can the medical officer of health do certain kinds of things or call certain kinds of things or push certain kinds of buttons to increase the alarm around certain situations and make people take it more seriously? That's a situation I just see downtown all the time, right? Where we're caught in a system. And then I look at the legislation sometimes and I think to myself, it seems like there's a role for us somewhere in this. So that's just me saying, I think that's what I want to explore in the next action plan is how does this board, right, work better with the public health staff to figure out how to become as toothsome as possible. I think we have to do that in order to ensure that we're really serving residents as best we can because their expectations are just different, right? I think it was, again, when councillors were sitting around here and it wasn't the Board of Health, it was a different activity for people. And now they perceive it differently. So I think that's what I hear throughout these meetings, by the way, also is a kind of tension between all of us being like, you're trying to be like, hey, the staff are being like, we want to find a way to make these reports make sense. And people here like, I'm not sure they do. So how do we come together around that? So that's my focus, is trying to make sure that it makes sense and the public can turn to the Board of Health more often, right? We're not seeing a lot of delegations here, for instance, right? I think that's an important note to make, right? Is as we become more active, hopefully, and the public sees us as a conduit to get their issues raised, we'll start seeing more people coming forward when they start to understand what our role is. So thanks, that's it for me. I'll take the chair back. I see no other speakers on the subject, so we're gonna go to receiving the report recommendations electronically. And that vote is up. And Member Safi is in favor.
Member Danko, are you able to vote, or I can take a hand? Great.
Okay, Member Danko is also in favor. Thank you. And that carries 11-0. And now we're on to the bylaws. So may I please have a mover and a seconder to approve the bills? Moved by Councillor Huang, seconded by Member Danko. We're going to need to require an electronic vote for this one. I'll also take thumbs up from anybody who can't get the electronic robots to operate properly. It's not your fault. Sometimes they are cranky, and that's their prerogative. We put them through many rounds of abuse daily. Member Danko's in favor. Member Safi, are you also in favor? You are. Excellent. That carries 11-0 as well. As there's no further business for today's meeting, it is adjourned at 10:53 a.m. Have a lovely day, everybody. Thank you.